Diversity, equity, and inclusion, commonly referred to as DE&I, has become an important issue across multiple industries, including healthcare. There is now a realization and an acknowledgement that having a workforce that reflects the community and the patients that you serve leads to better outcomes. In the past several years, DE&I initiatives have not only gained traction in healthcare organizations, but have yielded some great results. But healthcare is now dealing with a workforce challenge. So how can we balance DE&I with the fact that we can't find any nurses, technicians, IT experts, or back office administrators? Joining me today on the program is Shanil Ebrahim, partner at Deloitte Canada. Shanil is a life sciences and healthcare consulting leader. I'm excited that he's here because he has a unique perspective, given that he works with so many different organizations in the healthcare ecosystem. Shanil, welcome to the program.
Thanks for having me.
I'm excited to dive into this topic today. As you know, DE&I is definitely very, very hot in the market right now. A lot of people are doing it, but I'm excited to talk to you because you've got that perspective across multiple organizations and can really bring us some valuable insights today.
Yeah, awesome. It's obviously a very important topic, and especially in relation to obviously the workforce challenges that we're having. I think it's obviously something on top of everyone's mind.
So before we dive in, maybe can you give us a quick definition of DE&I and what that means in the healthcare context?
Yeah, absolutely. So obviously this term has been increasingly prevalent, not only in Canada, but across the world, right? So you see a lot of different organizations using kind of different sequencing of these type of terms. So whether it's DE&I, ED&I, ID&E, but largely the elements have stayed intact. I like ID&E personally because I feel it captures the sequence, and the I, the inclusion, is essentially actions that we take to understand, embrace, and leverage the unique elements and identities of individuals so that everyone feels welcomed, valued, and supported. Diversity, to me, represents those characteristics which we're either born with or we gain through experience. Things like education, we gain through experience, but there are cultural, religious, and racial factors that we're generally born with and evolves through experience. And that kind of shapes our perspectives and allows us to be different in society. And then equity, to me, is ultimately the outcome of diversity and inclusion, where all people have fair access, opportunity, and resources to thrive in an environment. And ultimately, the goal, if we're truly equitable, would be to eliminate any sort of systemic barriers or privileges that result in significant disadvantages to different folks. And you can debate the semantics of what I've just said, but generally, I feel that it captures the elements of all three.
Well, I mean, for me, DE&I, IDE, it's definitely worth pursuing. I mean, it's definitely something that we should have been doing all along, frankly. But as you know, right now, healthcare is facing a really, really tough workforce challenge, right? On one side, we have clinicians and supporting staff that are suffering from overwork and moral injury and burnout, and many are leaving. And so there's really this struggle to just bring on anybody. So how can DE&I exist, or how do initiatives get traction when there's such a challenge in front of us of just getting people in general?
Yeah, it's a great question, and one of the I'll take it a couple steps at a time. So the first premise is first understanding, well, why do we need DE&I in healthcare? And we at Deloitte have done some extensive research on healthcare executives' perspectives on health equity, and many see the strong connection between diversity and inclusion within their workforce and improved health equity outcomes. And to me, this makes intuitive sense. A diverse, inclusive healthcare workforce that look and feel like the community we are serving can help improve trust and empathy and strengthen the same connections with those communities that we're serving. So of course, intuitively, that makes sense. And there's been a great relationship that we've seen in terms of if we truly have a diverse workforce, it does improve organizational performance. So, both of them seem seem quite intuitive that yes, we should move, towards that facets. Now, what you mentioned is an excellent question in terms of, well, if we're looking for a diverse workforce, especially when there's a shortage, are we hampering ourselves? And that is a very, very important question. But I do first think that we need to think about why there's a human health resource shortage in the first place. In Canada specifically, I know this happens globally, but in Canada, there's some distinct elements on why this happens, and I'll connect it back to DE&I and how they're interrelated.
Sure.
So our chief economist at Deloitte, Craig Alexander, he wrote a great piece on the labor shortages trends and went into depth on why this is occurring. I'm not going to go into all this detail. I think people should really check it out, but I want to highlight some key points that he mentioned. First is that the Canada labor supply primarily declined due to a drop in labor participation of older workers that were aged more than 55, and essentially they retired early in the pandemic. And even though labor participation of those who were younger increased, it just wasn't enough to offset the loss of the older workers. So that was the first reason. The second one was there was dramatic swings in employment and just by industry and occupation. Things started moving much more towards service producing sectors. So healthcare actually benefited where we actually increased the number of individuals in the workforce. But the third one, which I think is going to be the most important one, and it's one of the ones which are most constrained, is we have some critical structural factors that are constraining us. We have an aging population. We have significant underutilization of pools of labor. So we don't tap into the Indigenous and the First Nations populations well. We don't tap into visible minorities, women, disabled Canadians. These are underutilized pools of labor. And we traditionally in Canada also have a heavy reliance on immigration for close to 100% of our net labor force growth. So what happened during the pandemic? Disadvantaged people became more disadvantaged. Female labor workforce was the lowest it has been in 50 years, and immigration just halted to a stop at one point. So now coming back to your question, yes, we have an issue, but DE&I can actually help improve these workforce challenges, because to solve for the shortages, we can tap into the pools that are fundamentally diverse: immigrants, Indigenous people, visible minorities, women. So I look at DE&I to be the solution to address the workforce challenge as opposed to it being the barrier at the end of the day.
So what are some of the necessary steps then to make DE&I initiatives successful at this moment? Because let's be honest, right? When I can imagine if I was inside a hospital right now saying, hey, we should do some more of diversity, equity, and inclusion, and then kind of getting that skeptical look like, well, I can't even hire nurses. Right. So how do I make that argument that you just made to an executive? And what are some of the steps that I have to take here?
Yeah, it's a good question, right? So I think fundamentally we have to think about, what's kind of working and what's not working within, with relation to DE&I in the workforce. So, what's working is great that there's DE&I initiatives that are widespread, they're funded, they're starting to be connected to business priorities, and especially it's ingrained in now the strategic direction.
Right.
What's not working, or maybe I should say what can be done a little bit better, is there's still lack of accountability and meaningful measurement around DE&I. There's still a perception that this is kind of check the box. There's also issues that, the top of the organization a lot of times doesn't look like the rest of the organization, right? So these are things that we still need to solve for. So when I think about, what are the, let's call it the best practices or things that we need to do, well, like I look at it in, 3 to 4 different key things. The first one is we have to make DE&I enterprise-wide. Largely, we still look at this as a HR problem,
Right.
And it's not an HR problem. It's a board and an entire C-suite involvement. So if we truly want to hardwire DE&I across the organization, it can't be check the boxes all here. Yes, we got a DE&I initiative, but it really needs to be embedded throughout the talent process: onboarding, continual training, employee reviews, compensation, performance measurement. So all those items. Second one is cultivating DE&I through executive sponsorship. Now, whether it is onboarding, employee reviews, we essentially need an exec sponsor. And Colin, one of the things I think is also important is who the exec sponsor is supposed to be. A lot of times we start to see that DE&I initiatives are sponsored by visible minorities or females or those disadvantaged almost exclusively. And that's a fundamental issue, because if our leadership is mostly white men and they're the current leadership, they need to be part of the solution as well. So you need a mix of those individuals and people coming from diverse backgrounds, as opposed to saying, white men are our current leadership, all DE&I initiatives are by everyone else, and that's not going to intermingle across the organization. So that's why executive sponsorship that look and feel like the rest of the organization is also important. And the third one, I think, is we truly need to get serious about looking at the talent and leadership pipeline. So where is the talented pipeline? It's not just nurses and doctors, right? We're talking about everyone in the healthcare workforce: cybersecurity individuals, technicians, personal workers. And the common complaint is, hey, we're not able to find a diverse workforce. But a lot of times this is unfounded. We're probably looking at the exact same places, first of all, where we attract the same type of talent. We reinforce the belief that diverse candidates are nowhere to be found, but we need to look elsewhere where there's associations which have more minorities and females, and that allows us to tap into a different pool as well. So those are three, I would say, practices that are important. Actually, you know what, let me add in a fourth one, which is we need to measure and lead with data. So clearly define objectives, communicate how we're measuring it, track the progress, communicate the findings. These are metrics that are important. Without data, I don't think we can really understand where we're actually going and how well we're doing it as well. So those are essentially the 3 to 4 things that I would want to highlight.
So how would I go about assessing, like if I was an organization, if I'm a hospital, if I'm a health system, how do I go about assessing my talent pipeline? Like, is there something I can measure? And maybe that sort of asks another question of like, what does a good pipeline look at? Like, do I have to have a relationship with my local nursing school? Do I have to have a relationship with the local med school kind of thing? Like, maybe you can describe that for us, and starting with how do I assess it, and then how do I measure it?
Yeah, it's a great question, right? So what you just mentioned is essentially the first step. Is we need to understand what does the demand start to look like for the next 10, 20 years, to understand what are going to be the critical issues that we in healthcare need to solve. So that's number one, fundamental, is demand planning. And then the second part related to that is, what are the appropriate resources that we need? And I don't just mean clinical resources, but also non-clinical, because IT technology are completely underserved in healthcare right now. Technicians, back office transformation, which is happening across all provinces right now. These are areas that don't have enough talent as well. So we need to look at what is the level of supply that is actually needed to address that type of demand, first of all. Then the question is, now once we understand the demand side of the coin and the supply side of the coin, the question is, well, what are the ways to actually get the supply in place? And the reality is, like it or not, healthcare organizations aren't some massive talent beds for some of those areas. Clinical, of course, but you being in technology, me being in technology, I don't look to healthcare organizations in terms of being the hot talent bed, for example, in tech. So you need to think about, well, where is the hot talent bed? So professional services firms like Deloitte or Accenture could be, technology vendors that you start to see, the Amazon, the Googles of the world, of course. So the question is, if they're the hot talent bed and you need those resources, well, that's where partnerships can start to come into place. So you need to think about not just directly hiring, but there's outsourcing models, there's partnership with ecosystem in terms of who can collectively work together to address the supply shortages so that not everyone's competing with each other, but they can actually work with each other to address the shortages that we end up having.
I like your idea there. I think when we do think about talent, we always think about hiring that talent
Right.
rather than partnering for it. And in the tech world, definitely there is some opportunity to do other things than direct hire, because you're absolutely right. A cybersecurity expert coming out of college is probably not thinking that healthcare is a destination for them, right? They're looking at the tech giants, they're looking at these wonderful places that have pool tables and beer Fridays, right? They're not thinking about healthcare. But they could, right, if they just knew the value of what their work could mean. Or better yet, you might partner with somebody who's a cybersecurity expert, to give you that augmentation to your existing staff, or to take that over for you if you have to outsource.
Yeah, that's exactly right. Like, what you just mentioned is important, right? Because, a person who's coming out of school or, anywhere, they're thinking about two things, right? Well, one, I want to sharpen my skills. I want to work with like-minded people. I want to flex those, similar type of muscles. So when you're in a larger organization where there's a lot of people you can learn from, that's exciting, right? And a lot of times in some of these organizations, you might be the only person. Great, you have a lot of independence, but you don't get to really learn and sharpen your skills. So that's one side. And the second side is then the application. Well, it's not just good enough to flex your muscles. Healthcare, that's one of the most exciting things, that you can actually make an impact. So the application really draws people in. So that's where the partnership really can work together to say, well, you help kind of nurture and sustain the talent, and I will give you kind of the playing ground, for lack of a better term, to apply your skill set. So it really does work. Now, but the problem I do find, and this is a conversation I have with a lot of different healthcare organizations, is um, executives look at partnership or outsourcing as, that's a cost, right? That's, it's going to cost me 2 times more. Why wouldn't I just hire them? Well, you got to sustain the talent and you got to make sure that they stay. So I always think, well, what's the opportunity cost of not getting the right talent and creating a massive, talent debt at your organizations to advance your outcomes? To me, that could cost you 10 times more than the outsourcing cost. So you got to really think about, what it takes in place to keep your talent, to make sure you have the right talent in place. And if you kind of do that economic equation, outsourcing looks extremely attractive, and partnering seems extremely attractive than not doing it.
Yeah, especially in the light of the tech crunch that we're going to be in for the next decade, right? Where there's just not going to be enough specialists. And
That's exactly it.
to your point, even if you hire the best person available at the moment, can you keep them for those 10 years? That's going to be a challenge given hospital budgets and healthcare budgets. But
Yeah.
What the uptake of all this, Shanil, that I'm hearing is, we don't really have a short-term solution. It's a long-term. We need to think long-term. Like you're talking about fixing DE&I issues sort of by going all the way back to the talent pipeline, going back to schools and how you're attracting people in the first place, and changing how how organizations and the ecosystems interact with those early stage talent pools. So given that it's going to take a few years to solve this, or that we have to work towards it, what are some of the things that we can do now to set ourselves up for success, 3 to 5 to 10 years from now?
Yeah, that's a good question. Yeah, so some of these things definitely are longer term solutions, especially as you think about kind of influencing policy initiatives, influencing schools, in terms of thinking about the long-term pipeline. But there are some of the things that I mentioned that are short-term. Partnership and kind of a shared services model to kind of fix some of those problems, especially with DE&I, I think can be put into place immediately. There's nothing that is actually stopping a lot of healthcare organizations to work with different organizations where these are hot talent beds and they tend to be in scale, and they are ones that are much more diverse at the end of the day, especially when you think about some of the technology vendors and the professional services firm that have DE&I initiatives embedded inside their talent pool already. that's where you can start to address some of these things in the short term. And then the second thing, just in terms of, the comment that I mentioned in terms of, we have a lot of underutilized uh, pools of labor right now, from Indigenous people to women to minorities. The question is, well, first of all, these are people who want to work but can't find work.
Right.
So the education initiatives that we put in place to make sure that we're retraining them, that's something that could be put into the short term. Will it solve the things in the next 6 months? No. But can it be solved within a year? Yes. Right. A lot of times we can end up training them, or even some of the most foundational, even sometimes I don't want to call it basic, but some of the more I would say simpler type of professions that are in healthcare, where it doesn't take years of schooling to do a clinical type of position, but it takes much less to do technician and personal support work and so on, where they're extremely valued in terms of what we need to do, but the training isn't as long as some of the clinical type of professions as well. So those are ones that we can actually use to retrain individuals.
One of the things that you mentioned, or that I'm hearing in your answers, is how much the ecosystem, government, hospitals, med schools, have to really come together to make this work, right? You're talking about policy changes, talking about influencing policymakers. That's a big ask.
Right.
Definitely a big ask. But what are some small steps that you see that we could do to bring the ecosystem together? Like, is there a rally point? Is there, a cause? Is there something that you think could work to really bring all these folks to the table?
Yeah, it's a good question, and I think especially in today's environment, I think it is going to be very interesting, right? So we're in this place where we have a human health resource shortage. At the same time, we're going into recession,
Right.
and you're starting to see a lot of organizations starting to let people go, and especially like technology companies.
Sure.
That to me itself is a little bit of a marriage that's actually happening, where you can start to have these organizations that kind of need each other, where they say, well, don't let some of your people go. Could you ring fence some of your people, let's say 5% of your workforce, based on XYZ skill? I will continually partner with you to make sure that I end up using and leveraging those type of resources going forward. So I think one of the great things, and this is something that I know Deloitte does a lot, where we bring a lot of organizations together. We bring the technology vendors, we bring in the healthcare organizations who typically don't talk to each other. And through that, we end up creating similar type of partnerships. Now, you don't necessarily need to do it Deloitte, because some people go through university or other consulting firms or so on, but there are people who end up thinking about this all the time in terms of how do we bring the ecosystem together. And that's something that we should always leverage. That would be the first step in terms of just understanding who can actually first solve my need, and technically what are the challenges that they're dealing with, and how do I make sure that we cohesively work together to actually solve that problem.
I can't leave this interview without asking you a little bit about technology, given our audience.
Right.
So Shanil, given everything we've spoken about, what role does technology play in any of this?
Yeah, it's a good question, right? So technology plays a pretty big role, and when I use the word technology, I think about everything from digital backend data, AI applications, everything in one. And right now, there's a lot of HR and recruitment tech solutions that are out there. Just trying to give you some examples. SAP, I remember, had a business beyond the bias initiative that they embedded into their platform that eliminates inherent biases around age, race, ethnicity, LGBTQ communities. So that's one example. Workday has offerings around value, inclusive belonging, equity index called Vibe, and that sometimes is for organization specific, but that can actually be applied across multiple organizations to understand what is equitable. Qualtrics launched a solution with pre-built questions to help company executives to understand inclusion and diversity in their company and to understand the gaps, for example. So those are some good examples from, let's call it, foundational tech solutions that can actually help address some of the diversity, equity, and inclusion problems. AI and machine learning has done a lot to address DE&I, and we use a lot of these in-house. So good examples are where we end up using algorithms to prevent historical patterns of underrepresentation. And ultimately, these type of analytics can help evaluate, well, what programs are working. So coming back to partnerships and so on, we can see, well, we've put a program together to completely exchange talent. How well is it working? And how can these type of platforms support who we hire, how to manage them, develop them, provide them rewards? So all these tech solutions do a great job. And a lot of the ones which I mentioned are some big companies, right? Like SAP, Workday, Qualtrics, that can help address the problem. And I think just based on your footprint, you can actually leverage it very differently to ensure that you're, one, addressing the shortages, but also ensuring that you're bringing a diverse and inclusive type of environment to your organization as well.
We've covered a ton of information today. Thank you for sharing all your amazing insights. My final question for you is, where can people go to find more information about what we've been speaking about today?
Yeah, that's a good question, right? So I think there's a few, because we obviously covered quite a bit. In terms of diversity, equity, and inclusion, there are some really good articles specifically around healthcare that I know Deloitte has released, which I think could really help people in terms of the literacy in this area. I would definitely ask people to really check that out. In terms of some of the labor shortages, Don Drummond, has put out some really fantastic pieces in terms of the labor shortages we have. Craig Alexander, our chief economist, has put out, an article just, I believe, last month or 2 months ago, just around where we're starting to see the shortages and how these underutilized pools of labor can actually help. So that's another one. In terms of some of the technology solutions, some of those big vendors around SAP, Workday, Qualtrics, those are just some examples. I would ask people to check those products out as well, especially for their organizations. And then the last one, which is, our MPPs and our policymakers at the end of the day, they end up having a lot of these in their policy as well. So I would urge us as citizens to check those out and figure out how we can help shape them as constituents as well. So that's the last thing I would also urge as well for people to check out.
Shanil, thank you so much for your time today. Really appreciate you being on the program.
Yeah, really appreciate it, Colin. It's obviously a great conversation. I could talk about this topic for a long time, but really appreciate the time.
I want to thank Shanil for spending time with me today to talk about DE&I initiatives at a time when healthcare is struggling with the workforce challenge. I loved how he was able to make the case that DE&I initiatives can actually help organizations tap into underutilized pools of talent. To find out more about Deloitte, visit their website at deloitte.com. And hey, if you enjoyed this interview as much as I did, we'd love for you to subscribe, rate, and give us a review wherever you're listening and watching this. Also, head on over to healthcareitttoday.com to access free resources, industry news, and insightful articles. You can also connect with us on Twitter using the hashtag HITSM. I'm Colin Hung. Thanks for being here.